digestive disorders. When we're talking about gastroesophageal reflux disorder, or GERD, or irritable bowel syndrome, or ulcerative colitis, or Crohn's disease, all of these, when we look at it, those are not diseases. Those are the body adapting to toxic deficient circumstances. To drug a body when they're adapting to toxic deficient circumstances doesn't make sense. Let's just take GERD, gastroesophageal reflux disease. You figure that you've got a stomach and an esophagus that goes down into the stomach. Now there's sensors inside of the stomach that sense if there's more acid. There's actually a muscle on top of the stomach that tightens up to keep those stomach acids inside of the stomach. That's right. More acid in the stomach stops reflux, stops that indigestion. Now there's still doctors out there that are prescribing the little purple pill for 24 hours of relief, or antacids, or Tums, or Rolaids. Well, that doesn't make any sense. That little purple pill, the proton pump inhibitors, actually increase esophageal cancer. It causes what they're trying to prevent with it. And why would that? Because the more acid that sloshes up on that esophagus, it's totally different tissue. So here's one of the methods that you need to do to fix gastroesophageal reflux disease. First, drink no water a half hour before a meal. Drink no water during a meal. Drink no water a half hour after. Why? Because water dilutes the acid in the stomach. That's right. Reflux comes from too little acid, not too much. So also, if you have physical, chemical, or emotional stress, that's going to put your body in this fight or flight state. And that decreases digestion. So what would chronic stress do to digestion? It would cause increase in digestive disorders. Also, let's look at some of the things that can cause neurotoxins, cause leaky gut, cause damage to the intestinal tract. How about pesticides? How about vaccinations? How about antibiotics? How about chlorine in the water? Let's look at all the toxins that your body's exposed to that can actually damage the intestinal tract lining. And also, if you're under stress, that's going to decrease the blood supply and nerve supply to the gut, making the body less able to adapt to those toxins. So if you're confronted with an inflammatory bowel disease, and I'm talking ulcerative colitis, Crohn's disease, all of them, you need to correct the problem. You don't need to take a steroid to decrease the inflammation. You don't need to take an antibiotic to stop the bacterial infection that's secondary from the tissue damage. What you need to do is restore the health to the tissue. And that means reduce the physical, chemical, emotional stress. You have to restore the health of the gut. And that means you're going to be juicing and blending and finding out the problems with this. So you're pre-digesting the food, and you need to heal the gut. But really respect your body. You don't drug symptoms. And if you've got a doctor drugging the symptoms for an inflammatory bowel disease or drugging the symptoms for gastroesophageal reflux, fire that doctor. Was that clear? For the detailed research, data, and case studies, click on the link and watch the full Health Talk video. But really trust your body. Trust that it's designed to be healthy, and health is the natural state.